Hi CAM followers, and welcome to another of our Facebook events. Today we're very lucky, we've got the fabulous Laura Woodward with us. Laura is a vet primarily, but also is what we call the counsellor to the veterinary profession. So she's amazing with mental health issues, which we know is a real problem within the vet profession. I'm going to pass over to her and she can introduce herself a bit better.
Thanks, Esme. So yes, you're right. I've been a vet for over 20 years now, a surgeon the whole time, which is wonderful. I deal with lameness and a lot of arthritic animals as well. I've been in the same practice for 17 years now, so I understand what it's like to have chronic disease and to be looking after these clients. I became a counsellor 5 years ago. A general counsellor. I've also specialised with child and adolescent counselling, and I'm a mindfulness teacher as well. The counselling has evolved into being counselling for vets and nurses for our profession because our needs are so great. And I think as a profession we've come to realise this now, that our needs are great and we don't have to put our heads in the sand anymore. It's no longer a taboo to have mental health issues. So yeah, it's really nice to have a chance to talk with you and to talk with people on the CAM forum.
Absolutely. Thank you so much for being with us. So I think we'll get straight into it if that's okay with you. The big topic we wanted to discuss today was how managing patients with chronic disease and euthanasia affects us as vet professionals.
I think they're two separate things. One is managing chronic disease, and euthanasia is a separate thing, which sadly often comes having managed a chronic disease for so long. Managing chronic disease, I think you'll know yourself, can actually be very rewarding. And if we have a patient that we've been looking after for a long time, we become very bonded with them. So I think the reward that the owner might get from medicating their animal and it being successful, we do get the same reward and the same good feeling as well. Yeah. So managing arthritis long term, it can be something we're managing for many, many years. Yeah. Labradors with juvenile conditions can grow up to be 10-year-old Labradors who have the repercussions of those conditions or everything that supersedes those conditions, and we might have been with them for their whole life, as I have several times over. And I think it can actually be very, very rewarding. It can bond you even more with that animal as well as the client. Yeah. And while the client might know that we're bonded with them and we have a connection with them, I don't know if they always understand how much we really care about the animal, how much we have that bond, that contact, that desire for the animal to do well. Yeah. So maybe it's nice for clients to know that, yes, we care about them, we care about our job, but we probably deeply love their animal, because yeah. Many vets I know have become vets because they love animals. I think as vets we actually need to love people too, but that's not always the case. Sometimes many of us prefer animals to humans. So I think it's important for clients to know that we get a great deal of satisfaction, very often a great deal of reward from managing chronic disease. Yeah. I'm a surgeon, not a medic. When I look at the medics I work with, when I see them juggling all these different conditions an animal might have, one might be arthritis, one might be a metabolic disease, something else might be even a chronic low-grade cancer. And I see how clever they are managing and balancing all these medications and the owner's expectations and really assessing the animal's quality of life. It's a very holistic approach. Yeah. And that can feel very rewarding as well when it's successful. So I think the actual chronic disease managing it is a good thing and a feel-good thing.
Yeah, totally agree with that. Totally agree, because that's, I'm still a fairly young vet, and that it's ended up being, I don't know, I guess at vet school I probably didn't think that much about arthritis. I didn't think it would be my specialism, if you like, or my area of interest, and then it's become the thing that I love the most, and I am so bonded to my patients and I spend so much time with them, and I honestly don't find anything more rewarding than seeing a 12-year-old dog and being able to get an improvement. I find that the most satisfying thing. but there is a hard side of it. There is a stressful side when things aren't going well. But in general, I think I absolutely agree. I get the most job satisfaction, and I don't really consider being a vet a job. I think it's a lifestyle. So it's every day. I'm doing this as a vet at my practice, and I also run my own little pain clinic. And I do that from home. So I literally see my patients at home. So there's no space for me. It's all chronic pain in my head, but I love it, and I absolutely adore seeing patients improve. So I think you're absolutely right. I think sometimes on the mental health side of things, we focus on the negative, but there is a huge positive side to managing chronic disease when things are going well.
I agree. And when I speak to vets, when I'm counselling vets, I rarely find that a chronic disease is actually a source of anxiety or stress or disappointment for them. And you'll have seen it yourself. Animals are amazing. And compared to humans, they have such a fabulous attitude towards, I'm in pain, I don't want to walk, I'm out of pain, life is great. Yeah. And humans often won't be as helpful as that, or as wonderful. And I have arthritis myself, rheumatoid arthritis, and I feel sorry for my poor rheumatologist. It's so difficult for her to get things right, to balance things. And I see in her waiting room, I'm generally quite upbeat and optimistic, but her waiting room is full of people who are sad and worn out and exhausted and in pain. And I feel really sorry for her and her emotional load. But when we're treating animals, they don't have all those psychological repercussions or psychological effects of the arthritis. They either feel like going for a walk or not feel like going for a walk. They may feel like they're in pain, but they still want to get on with it. They don't generally feel sorry for themselves. So your first question, I think, on our mental health, managing chronic disease and chronic pain, I think actually can be a very fulfilling thing. Taking your work home with you, I would say, when managing mental health and trying to separate work from the time you're outside of work where you recharge your batteries, not the perfect formula, but then you're deeply dedicated, as many of us are, and it shows.
You just have
I would wonder
physical space, don't you? Like my treatment room is in my garden, so I can shut the door on it still, so that it's not in my house, it's not in the area where I relax with my husband. It's still separate. And previously I was going and doing home visits at people's homes before COVID as well, so there was that kind of going somewhere and coming away from it. But yeah, you do have to be quite careful. But I think I would say the thing I found hard doing that compared to just being a GP vet is that I've become quite involved in people's lives to a level that I wasn't before. In the practice there's a sort of a more of a divide there, which makes the end stage of life, which we're leading on to, a little bit more difficult, because you are more involved in all of the external factors when it comes to the euthanasia side of things. Because not only
you're right, and you're absolutely right, and when we manage chronic disease in our patients, you're right, we're not always just managing the chronic disease in the patient. As you become more bonded to the client and to the patient, and they see that you have this empathy and this compassion and you're a good listener, because we need to be, you find that they might offload onto you as well things that are totally unrelated to their animal's arthritis. And they do it naturally. They're not thinking this too much for the vet, because as vets, a lot of clients feel we have no life outside of work. We have no problems or concerns of our own. We have no sick old animals of our own. So I think you're right. Like hairdressers will end up not just cutting hair. They do listen to people's emotional burdens, and people offload onto them. I think you're right that it is a concern that you're not just dealing with the animal and its chronic disease. It depends on how much the client offloads onto you. And I don't criticize clients for doing it. I think it's a natural thing to do. But it does muddy the waters, and it does add to the burden.
So what's your experience of how vets in general cope with the euthanasia as a situation?
Euthanasia is a very complex subject. And as vets, we're the only profession realistically en masse performing euthanasia on an open platform. I think it's definitely easier for a vet than it is for an owner, of course, even though we care about the animal deeply. It's easier for us to get the perspective whereby we can advise the client adequately and where we can feel that we're generally giving correct advice, because we can remove ourselves that little bit from the animal. We're not living with them. And we can actually say what the client wants to know, which is, what would you do if it was your animal, which will be asked very often. So I think establishing when the time is right is definitely easier for us, and we're trained to do it. And we can look at quality of life from a holistic point of view. So while often deciding when the time is right is something that we're educated to do and we find not easy, but we can do. When it comes to it, yes, I think for sure we grieve our own loss of that animal. We cry, we try to stay strong for the client, and then we have the client's grief, and we care about the client too, so we see them brokenhearted, devastated. And I think at that stage it's very easy and quite dangerous to slip into sympathy rather than empathy, where we end up so brokenhearted that we can't even function. Because while the client, I think they generally don't mind if they see us shed a tear, we are the person in charge at that moment, and we have to be the person who does the right thing and makes the euthanasia smooth and easy and picks up all the pieces and sets the client straight. And then we have to go back to work. And then we have to look in on that client again and again and again. So I think the aftermath is very difficult. It's hard to grieve naturally, even though we may know for absolute sure it was the right time.
Yeah, I think from personal experience, I often I have like a professional head, and it comes on, and I guess it's just the more you've done, the more it happens. And then the second the client's out the door, then the emotion comes and hits you, and you get really upset, and you're always worried that you haven't seemed like you've been emotional enough, because you've tried really hard just to keep that all back, because you want that space to all be for them. But I have been many times where, you know, I've managed to keep myself together and very professional in front of somebody, and probably they don't realize how upset I've then been once they've left the building. I think it's tough. I think you're right there, and it's there is definitely a process that goes on, and there's so many things, practical things, that we have to concentrate and deal with and make sure it goes as smoothly and perfectly as possible. You don't always give yourself time at the time to think about it, because you can't, you just have to get on with it. And then, like you say, it's really tough, because sometimes you're doing that and then the next consult is somebody with their brand new baby puppy who is so excited, and you've not got space to then think about it at all. You've got to try and be like the happy person and excited for them, and it's tough.
It is tough, and I'm like you, the perfect professional, and if I've done a home visit or whatever, as soon as I hop in the taxi, then you just let it all out. And it might be nice for clients, I suppose, in a way, to know that we're so bonded that we cry our eyes out. Everyone cries their eyes out, and then we pull ourselves together. But yeah, you have to grieve. I think it's very important that we allow ourselves to grieve. It is a loss. It is sad. So I think it's, yes, we do then have to put ourselves together for the next consult, but allowing ourselves to grieve and recognizing that we're sad and that's okay, and accepting these feelings of loss, rather than shutting them out, which they will come back to bite us. So when the consultations are finished, or when we do go home at night, I think it's actually very healthy then to allow yourself to grieve, to feel sad, to recognize the sadness, to give it a name, rather than just trying to push the feeling away as if it's not affecting you, because that's just denying yourself that chance to process it and to move on. I think another concern is when, and it doesn't very often happen if you have bonded with the client, it's if the client doesn't agree that the time is right, or their vision is so clouded they can't see it. And that does happen very often, especially with animals who have horrific intractable arthritis and nothing else, because they may be so bright around their head and they're still wagging their tail and they're still happy to see you. They just can't get up. So when you know their quality of life is unacceptably low, if the client then doesn't agree, I think that's very, very difficult. But again, we have to accept that they feel the way they feel. And we have to be with them in that moment. So that can have a huge toll on us, knowing that the animal's quality of life is not good enough, that they should be continuing. And I think that probably has more of a long-term emotional impact than the relief we may get when the client agrees with us and we do in that animal's life.
Yeah, I think that's very true, and it's not something I've really thought about. I think, you know, I'm trying to think of the euthanasias that have upset me the most, other than obviously the dogs that I've really bonded to. I think the things that have stuck with me for a really long time have been actually cases where you know, I had an 8-year-old Westie brought in once, and the owners had tried some kind of joint supplement. It hadn't improved its arthritis. We assume it started some arthritis. It was a little bit stiff, and they didn't want to do anything else. So they then demanded euthanasia, and that was a really, really, really tough situation, and particularly for someone like me who, you know, my passion is in arthritis, and I'm thinking, you've got millions of things to do, and then they're saying, well, if you won't treat it, we're just going to dump the dog. So that's, you know, so you end up in this horrible situation, and those are the ones that I find extremely difficult. I think behavioural ones are tricky too, with young dogs with behavioural problems. They can be really difficult, particularly if the owner's not willing to consider any other options for that dog. What would be your recommendation in those cases, and how to cope with that?
Well, I think what you're describing is what we call moral injury, and moral injury can have huge psychological scars, long-term scars, if we don't deal with it. And moral injury is when you know that you didn't do everything that you could do for an animal, and this is what we're programmed to do, is everything we can do, within reason, of course. Even when the client is a tight budget, we are programmed to do everything. And at the moment, with the coronavirus crisis, a lot of vets are suffering from moral injury. A lot of doctors are suffering with moral injury, because we're not doing everything we can do. It's just not possible with social distancing, with video calls, with all our ventilators have gone to the NHS, so we can't even ventilate an animal. So I think when a client won't follow our advice, and we know for sure our advice is the right advice because it's evidence-based and we've done it 100 times, and it's not just us thinking it's right, it's clearly morally right. When they don't agree to that treatment and they won't allow us to offer that treatment, we know we're not doing the best for that animal, and that is an innocent being, and with someone else's ownership, that animal might get the very, very best. Sometimes our hands are tied. It's very, very difficult, and we have to accept that the owner is the owner, and they will often choose to go against our wishes. And if they choose euthanasia when euthanasia really, it isn't the time, and it's not the right decision, I think it's extremely difficult. I think if we do perform that euthanasia and we know it was the wrong timing, to then just say, oh, well, this, or never mind, that is not going to help us at all. The psychological scars, we need to give ourselves time to process what's happened, what we feel. When we feel loss, we feel moral injury, we feel unethical, we feel shame, we feel sad, we feel disrespected, we feel all these multitude of emotions. And I think it's good to give yourself some time to take this bundle of emotions in your head, to sort them out into one emotion at a time, to give that emotion a name, to feel it thoroughly. So if you're feeling angry at that client because they've done what's obviously the wrong thing and ended this animal's life, to feel anger is not wrong. It's what we do with that anger that matters. So if you accept that you're feeling really, really angry, to feel it with every fiber of your body, and to allow yourself to really accept that that's one of the things that's keeping you awake at night, sometimes by doing that, by giving it a name, by appreciating that's what you're feeling, and by feeling it as much as you possibly can, it then it diffuses that emotion.
Yeah.
And it has less of a hold on you. So while you still feel anger, it's not something that's making your heart race. It's not something that's making you feel nauseous. You feel angry, you accept you feel angry, you've given it a name, you know why you feel angry. Now you can move on to the next emotion.
Yeah.
And by doing that with all the plethora of emotions that it might have brought up within you, you do diffuse their hold over you.
Yeah. I think, yeah, it's absolutely so important, isn't it, to not brush things under the carpet and learn. I mean, you know, I've been a vet for a bit longer now, and I'm probably more forceful with the way I, you know, I'm a bit of a people pleaser as a person. I think there's quite a lot of vets who are like that, and I think now, had that situation come in, I would refuse to do it, and I could stand my ground, and I know what I would do. But you know, I'd been a vet for a few months. I didn't know what I was doing, and it was a situation that I didn't expect to be in. And I think it takes time and experience, and everybody's probably had a similar scenario of a pet that they feel the wrong decision or the wrong route was taken, and even though they might have been offering the right things, at the end of the day, we are just an advocate for the animal. We can't force somebody to make the decision we want them to. So yeah, I think you're right. Trying to get some closure on those experiences is a good thing, and also learning them so you're not in that same scenario going forward, I guess.
And you're right, it's easier when we're experienced vets. And luckily, I've actually, thank God, I've never actually done that. I've never gone to the situation or been in a situation where I ended up having to do that.
Yeah.
And now as we get older, we're more forceful, and people see that we're older, they're more likely to listen to us. And we can just say no in the nicest way possible, in a very long way, in a very cooperative way.
Yeah.
But I would be very pleased if the universities spoke to these new graduates about moral injury and euthanasias that you disagree with, and how to get around them, and how to get the client at least to contemplate what you've said, and to get them out of the practice with that animal, with your support, knowing that you're on their side, you're not against them.
Yeah.
But it's a younger vet's problem very often.
Yeah. Yeah. I think having that confidence in your own knowledge and your own ability, and that you are right in a scenario, that just takes some time, because you don't, you know, you're, I think it's that imposter syndrome, that you feel like you shouldn't be there, and you can't believe that your name was actually on the register, that it was actually you. But then, you know, when you first in practice, you're just relaying information that you've been taught. You've not experienced it yet, so it is hard to know that you are right, even though you know, because you learnt at university and they are amazing teachers there, and you have your moral high ground anyway, because you know what's right or wrong for that pet. But yeah, I think it just takes some time to really feel secure in your knowledge and where you're coming from, and not be scared for a client to be a bit upset with you for what you're going to say, and sort of learn to read people as well, because I think that's a really tough skill. Learning who the clients are, and how you can kind of predict they're going to respond, and how you can word things in a way that they may agree with more. I think that's important too.
A lot of it comes down to empathy, and empathy again is another complex subject. We could talk all day about empathy, but you're absolutely right. Empathy, the three main types. One is cognitive empathy, and that means you understand what the other person is saying. So they may come through the door and say, my animal needs to be put to sleep, end of story, that's it. And yet they could be saying so many other things behind that statement. It might be, I've lost my job. It might be, my partner has sent me down here, and they're at the end of their tether. It could mean so many different things. So it's understanding the language that they're using, and also being able to relate to them in a language that they're going to understand.
Yeah.
So very often it's the pregnant pauses where you stop, and they then follow that statement up with the background to why they got to that statement. And if they feel that you're against them and you're just not listening, I think the chances are more likely you'll end up with a euthanasia that wasn't warranted. Whereas if you listen and listen some more, and really show them you're listening by reflecting back onto them what they've said and using the language they'll understand, I think they're more likely to think, okay, this person's here to help me. There's no hurry. We can actually talk these things through. I think that's very, very important what you said.
Yeah. So in terms of tips for vet professionals going into euthanasia situations, what would you suggest?
I think if the situation is that you and the client have agreed that the time is right, I think keeping a professional head on is important. I don't think clients get upset that we're managing to keep the tears in. I think they need somebody to be keeping their professional hat on. So I would say do stay professional at all times, warm, kind, gentle, of course, no rush. And try not to put yourself in their shoes too much, because we all know we do need to get a cannula in the vein first go, nice and smooth, so that it's easier for everybody, the animal, the owner, and us. So I think that is a time I would say put the emotions out of your mind. And I never say this, but while you're being a professional, put emotions aside, get the cannula in, and then stop and pause. I think it's very important. Allow the client lots of time. And clients are amazing, because before you know it, and it doesn't happen in the human world where there's human death, before you know it, they're telling you how they got the puppy 13 years ago, the funny stories, the favorite bowl, and that can often happen within minutes of a client bursting into tears. So I think if those stories come while the animal is still with us, that can actually be really, really nice and cleansing. But I would let the client lead the conversation. Some clients want it over and done with really, really quickly. They just want it done, dusted, go. And then they'll grieve in private. Some clients want to be with their animal for an hour chatting to you before you do it. At some stage, there is a point where you actually need to inject the euthanasia solution. And the client is rarely going to say, or the client who's chatting to you about the good old days isn't going to say, right now is the time. So I do think if you're in that situation, again, you need to have your professional head on and say, okay, we're going to let him go now. And you do it, and then you're there in the moment. And I think it is reading the client's signals, and it's often the easiest time in the world to read their signals, because they're so emotionally vulnerable and open to you that you can. So it may be the time to stay quiet. It might be the time to give them a hug. That's not unprofessional. In fact, it's warranted, I think, every time. You can stroke the animal too. And eventually you'll know when the time to chat is, but you need to be reading their signals as closely as you possibly can.
I think that's such a difficult scenario, and I think you do get better at it. When you first do it, it's so difficult, because until you've maybe watched another vet do it at some point, but until you've done them yourself, you don't really understand what the scenario is going to be. And I think you do get better at them, and then you pride yourself on them, because I think that and the puppy consult, the two most important consults you ever do. So I think you're right, having that time for the owner is so important, letting them have the emotions they need to have and the time they need to have, and not rushing anything, and letting them lead the conversation.
I think it's very important, and you're right, it's so important to get it right. And it's good to be proficient at it. I suppose one of the mental health aspects of euthanasia on vets who have serious mental health issues can be that, because we know that with animals, our patients, when the quality of life is very, very poor, that we have this option, we have this way out. Unfortunately, as a profession, that has reflected on us, in that if our quality of life gets very, very poor, we can also choose that way out. And I think it's possibly our or the fact that we're so comfortable with euthanasia after some time, that we then become comfortable with our own euthanasia, i.e. suicide. And I think that's probably why our suicide rates are twice that of doctors and dentists. It's not necessarily that we have greater mental health issues or less good coping mechanisms compared to those professions, but I think it's our comfort with the relief we get from euthanasia. So I think it's a separate topic to how we would help the client, but I think it's important to know that that on our access to means. Of course, we can't just euthanize ourselves if we want to, and I think that's possibly one thing that has given rise to these shocking statistics that some vets are morbidly proud of.
Yeah.
And that's something that I think we need to be very mindful of, the fact that euthanasia is for animals and not for us as a selfish way out.
Yeah, I think that's true. And I don't know how well known. I think it's very obviously, suicide issue is a huge topic within the veterinary profession, but I don't know how well known it is by owners. I don't know if they realise there's such mental health issues, because they don't see that side of things. They just see the professional face that we all put on. So I think it is important to highlight that there's a huge mental health issue within the vet profession, nurses and vets. And as you say, we do euthanasia day in, day out, unfortunately. So it's sad, but it's a true fact of life. And I think we have to be even more mindful with this current climate pandemic, that we're going to have a problem with mental health in the whole country now, with everybody's, we've just announced today that we're in, I think, the biggest economic downturn we've ever had, and the future's going to be a bit tough. And our big motto within the vet community is to be kind, and that is vet to vet, vet to nurse, nurse to vet, and really importantly, owner to vet and vet to owner. And I think that's something that we try and encourage as much as we can here at CAM, trying to get a good relationship with your vet, because they're people too.
Yeah, I would thoroughly agree, and I think people are very, very unaware. People are absolutely shocked, because the queue to get into vet school is so massive, and yet very few people would be aware that the queue to get out of the veterinary profession is 52% have seriously thought about leaving the profession because they can't take it anymore. And it's really ironic that the queue to get in is big, but the queue to get out is massive, and it's very, very sad. And I think that probably leads us on to our next question in a way, in that why do we have such huge mental health issues? And clients and people who don't own animals are just absolutely shocked, because we're with animals all day, every day. We're cuddling these gorgeous creatures.
Yeah.
It was our life's ambition to become vets. How on earth did it go so horribly wrong? And is it real? And don't we all have the profession that everyone wants to have? And when you go to a dinner party, you meet people and they hear that you're a vet, and they think, oh my God, I always wanted to be a vet. Well, I don't then tell them, oh yeah, I'm also a counsellor, because we have such mental health issues. But people do become really shocked, and I understand why. And it's partly because we never told them. Yeah. We always had our head in the sand. We didn't even admit to ourselves that we had huge levels of anxiety. We didn't have imposter syndrome like you described, which is so common, especially in younger vets. We haven't really told anybody, so it's no wonder that people don't realize. Being kind to your vet, I think that would be wonderful. When people are kind to us or are grateful, it warms the cockles of your heart, doesn't it? When people drop you a thank you note, they may think that it means nothing to us, but it goes up on the notice board and makes everyone feel better. The fact that someone's gone to that trouble to say thank you, it's huge. But we don't have time to say thank you for the thank you note, because we're too busy. So they have probably no idea what a profound effect it has. I think people are very, very shocked hearing that we have mental health difficulties. It's not the client's fault. I would say it's because it goes back to when we're all so young and bright, and we may be 5 years of age, and we roll 2 dice in a board game and we add them up correctly. And everyone thinks we're some kind of mathematical genius. And maybe we are, I don't know. So but we go through life from a very young age when people spot you're clever.
Yeah.
And people will be really, your parents will be really proud of you because you're so clever, and your grandparents will boast about you because you're so smart. And the teachers will be really pleased with you because you've always got your homework done to a high standard. And then you do the 11 plus and you get into a selective school and you do well in your GCSEs and A levels, you get into vet college. So you've just been clever, clever, clever the whole way up and achieving. So you're succeeding. And at no stage, I find often, do people think, actually, is this kid developing other life skills rather than just being smart and exam results? Have they learned empathy? Have they learned social skills? Do they have any coping mechanisms? And a massive thing in young vets, have we ever failed anything in our lives? And very often, new grads will come to me and they've never failed a thing in their life. They've never got less than an A+.
Yeah.
And then you're in the workplace where every day we will all fail to some degree or another.
Mm-hmm.
It's usually tiny, and there's no detrimental effect on anybody or any animal. But it's a failure, nevertheless. It's imperfection.
Mm.
And people will lose sleep because we're not perfect. We've never learned to fail. People will leave the profession. People will actually kill themselves because they've failed at something and they've never learned to do that. So I think that is a massive thing with younger vets, is our fear of failure. And then, as you say, if something goes right, it then can't possibly be anything to do with us. It must be pure chance, the imposter syndrome. So I think it starts at a very young age.
Yeah. And then there's this sort of term that I would like you to explain, if that's okay, that we hear a lot, is compassion fatigue. If you could explain a bit about that.
So compassion fatigue is it's a form of emotional burnout, and that can happen amongst anybody who is empathizing with other people.
Yeah.
And more so amongst people who are sympathizing with other people. For example, your friend's upset and it upsets you so much that you're as upset as your friend, if not more so. So sympathizing and pushing yourself in someone else's situation too much can lead to emotional burnout or compassion fatigue fairly rapidly. As vets, we are in prime place to suffer from emotional burnout and compassion fatigue, because we are problem solvers and we're taking people's problems on all day, and 99% of the time we can fix these problems. We can mend that broken leg, we can rehydrate that animal, we can prescribe some medication to get rid of infection. So most of the time we're fixing. But nevertheless, we're taking people's concerns on board. It happens with our teammates as well, and that's inevitable because we're a close-knit team. So you will find yourself hearing other people's life stories. You will rejoice with them, which is great, but when they are down or stressed or upset, that will come on board as well. And if you're a good listener, which a lot of us are, you'll find that emotional burden builds up with time. As a surgeon, I've found myself for 20 years, unbeknownst to myself, being ensconced in theatre with yourself and your nurse, you do chat. Yeah. And you chat quite privately, and people pour things out. It's wonderful. But had I not learned from my training as a counsellor how to digest these concerns, I think I would have burnt out very quickly.
Yeah.
And as counsellors, we're lucky because you do learn to recognize emotional fatigue. You learn, it's all self-awareness, which is the first component of emotional intelligence. You do learn, what is this thing I'm feeling? It's emotional strain. As counsellors, we have what are called supervisors. Yeah. And those aren't people who are making sure we're doing a good job. A supervisor is somebody who you offload onto. Yeah. And each supervisor will have their supervisor who they offload onto. So we will chat once a week, once every 2 weeks, and give a rough synopsis of our cases. And that does relieve the emotional burden, and they relieve that emotional burden onto the person above them. and the emotional burden becomes diluted along the chain. So you never end up with this build up of emotional strain.
Yeah.
You learn how to deal with that. As vets, if we aren't mindful of this emotional burden, or if we're the kind of person who ignores all our own concerns and we don't want to face them, so we make sure we're just dealing with other people's concerns, then we'll burn out very quickly and fatigue very quickly, and then we're no good to anybody. So I think it's very important to be self-aware enough that we know when we need to take a step back, we know when we need to digest things, we know when we need to offload our concerns onto somebody else, in order that we don't suffer from that compassion fatigue. Because if we do, then like I say, we're going to end up irate, leaving the profession, having no quality of life at home, and basically being no good. And the clients don't need that.
No, I think that's something I've learned in the last couple of years, that I'm a bit of a sponge for other people's emotion. So and I don't think I had any awareness that I was doing it, but I would be so sad if somebody else was so sad, and stressed when somebody else is stressed. But then you just get to the point where you've got emotional overload. If you can't cope with all of that and yourself and everything else that goes on in life, it just becomes way too much. So it is trying to sort of separate yourself a little bit from those situations. And I think what you said earlier about sympathy versus empathy is really important.
Yeah, I think it's important to make that distinction. And it's very important to make some time so that you can sit and be and examine what is going on in your head and your heart, so that you can not fix it or make it go away, but just so you can accept it. Because like I said earlier, accepting these feelings is half the battle to stop them overwhelming you.
Yeah, absolutely. And I think that's something that most vets are probably having to learn to do all the time, because we, like you said, we have so much going on. We are very close as teams. I mean, my practice feels like part of my extended family, because we're there all the time. Well, maybe not so much at the moment when I'm furloughed, but normally I see them more than I see my husband. So you are very involved in each other's lives, and you are, things go wrong, it's lovely to have that support there. But I think you're right that there is the other side of it, that you have to just make sure you are coping and taking the right sort of steps to protect yourself from overload, really.
Yeah, and I think emotional empathy, which is the second form of empathy, which is the empathy that where we do feel each other's feelings to a degree, I think that's what gives us this great team feeling, and it makes us stronger, and it's a wonderful thing. And in our profession, it is quite unique to our profession, and I think it's wonderful, the mutual respect, the camaraderie, the rapport that we have with each other. I think it's very important to celebrate good things as well. So if something good happens to somebody, we need to bring that to the table as well if something good happens. And that's about noticing something good that's happened. So noticing how amazing the weather is and stopping to think about it and contemplate it, and tell your friend, look at that rainbow. Yes, we're manic at work, but you can actually stop and take 10 seconds to look at a rainbow and breathe.
Yeah.
So it's a wonderful thing that we can do for each other. And I think empathy doesn't necessarily always mean being there when the person's down. It means being there and celebrating with them when the person is up as well. I think that's something that as leaders from within, we could probably do a little bit more.
Yeah. I mean, we could talk about this literally all day. It's so fascinating. For me, very personally, it's lovely to hear and have things verbalized. Have putting words to some of the emotions I've had it's very I guess fulfilling, really. It's nice to have that from you, so thank you. Could you just give maybe sort of 5 tips that you would give to vets coping with sort of compassion fatigue and stress and the grief of euthanasia. So just some basic tips for them.
I could probably talk for 5 weeks about it. 5 points. I suppose going back to the basics of emotional intelligence, and emotional intelligence conveniently has 5 competencies. They are self-awareness, which means I'm aware of how I feel, I'm aware of how I would feel in a given situation, I'm aware of how a particular scenario affected me. So it's being aware of your feelings. Yeah. It's important to take the time out of your day to be aware of your feelings. And people say they don't have time, and I get that. But I'm being authoritarian, like we were talking about earlier, and saying, well, just make time. Yeah. And that involves, if you set your alarm for 6 o'clock every morning, set it for 5:30, and you have literally created time. So I would say take the time to ensure you're doing the first competency of emotional intelligence, which is being self-aware. Self-regulation is the second one. And that is taking these emotions and deciding what you're going to do with them, mm-hmm. externally as well as internally. So if I feel, supposing I feel fear about a surgery. So I've acknowledged that the feelings I have are fear and anxiety about this particular surgery. Then move on to the self-regulation. What am I going to do about it? Internally and externally. Well, internally, I'm probably going to accept I feel fear. Yeah. But if it's a euthanasia and a chronic disease, what am I going to feel in that situation? I'm aware that I'm going to feel grief. I'm aware I'm going to be nervous and fearful that I'm going to get it wrong. So I'm going to feel fear. I'm going to feel anxiety. I'm going to feel grief. With my self-regulation, what am I going to do? I'm going to put my emotional head on, my professional head on as well. I'm going to have everything prepared. I'm going to steady my nerves. I'm going to hit the vein first time. If I don't hit it first time, I'm not going to panic. I'm going to hit it the second time, and be aware of what you're going to do in that situation. I know I'm going to be sad. I know I'm going to grieve. And your emotional regulation or self-regulation will have told you, I'm not going to burst into tears and end up with the client consoling me.
Yeah.
The third competency is motivation. And motivation is about, here's a particular situation. What's the best case outcome? What do I want out of this situation, and how am I going to achieve it? And deciding what you want. So you want a smooth euthanasia, a happy client, composure. You want to be able to get on with the rest of your day. How am I going to achieve that? And you need to figure out how you're going to achieve all of that. The fourth competency is empathy, which we've only touched upon. And I think cognitive empathy is very important, understanding what someone's saying and being able to communicate with them in that way. And then other types of empathy, emotional empathy. So being with them in their feelings without overstepping into being that person. There are other forms of empathy, which we could talk about all day. And the fifth competency is social skills. So just being a really good listener, like really listen and stop, and eye contact and body motions, social skills, knowing when to be quiet, knowing when to talk. So if you can look up emotional intelligence and look it up on YouTube and listen to Daniel Goleman explaining emotional intelligence, I think it would go a long way to explaining what I think would be the start of improving one's mental well-being. And then mindfulness, which I could talk about for several hours. I think it's a buzzword and it's fashionable, but it is such a powerful tool.
Yeah.
I would say explore it, at least explore it, and think about if it's for you. And then if it is for you, then you can use mindfulness to achieve all of the above.
Yeah, brilliant. Laura, I mean, we could talk so forever. It's, I mean, this is such an important thing as well. Mental health is so important, and we couldn't possibly cover it in a short video, but hopefully we've gone some way to do a couple of topics here. So thank you very, very much for your time and for being present on the page for us, because it is important that we continue to improve our relationships between the vets and owners, and to improve vet mental health. I think that's it. The ultimate goal is to have very, very happy and fulfilled vets.
Thank you so much. And thanks for what you're doing. I think what you're doing is just amazing. It's so needed. You're being incredibly selfless about it. I admire you. I think it's something that someone needs to do. And you're doing it. So thank you.
The whole CAM team is amazing. And Hannah's award winning, and hopefully she's going to continue to win awards for us. But thank you. We appreciate that. And thank you again for tonight.
My pleasure.